Hello, my name is HWillis, and today I will be presenting my stakeholder education plan. I'm a psychiatric mental health nurse practitioner, and I'm employed at DSH Atascadero, formerly known as Atascadero State Hospital. I'm employed by this hospital since 1999. I started out as a psychiatric technician, a registered nurse, a hospital-wide supervisor, and in the last 4 years as a psychiatric mental health nurse practitioner. I also work in an outpatient practice that serves the northern Santa Barbara County patient as well as the southern San Luis Obispo patients since 1999. This is the practice that I will be implementing my clinical scholarly project. I have experience in outpatient, inpatient, forensic, adult, and child psychiatry, as well as in hospice, home health, long-term care, and med-surg. My clinical scholarly project is the implementation of a text message support application along with an education session to enhance smoking cessation in adults in an outpatient psychiatric practice, measured over a 4-month period. I will be conducting pre- and post surveys being measured over the first, second, third, and fourth month. The project plan will be submitted for IRB approval from Brandman University as well as the outpatient practice. And I will be obtaining, after that, I will be obtaining informed consent for the patient that will be participating in the project. The inclusion criteria I have for this project is the patient has to be 18 years old and older, have a diagnosis of depression, be a smoker, have a cell phone with text messaging capabilities, have text message at least once in the last 30 days, and have an interest in wanting to quit smoking in the next 30 days. The stakeholder group and role. The practice is very small. It consists of 3 people: the psychiatrist, the owner, the office person that schedules and does the billing, and myself, the nurse practitioner. The stakeholders that I have identified are the psychiatrist that owns the practice, the office person, and the patients. The psychiatrist would be, her role would be to assist me in identifying patients that are smokers and have a diagnosis of depression by conducting a chart review. The office person will be doing the scheduling and answering questions as needed, and then the patients will be participating in the project. The educational need that I have identified is that the psychiatrist would need to know the need and the value of this project, why the risk of smoking on this population's health, the benefits that we can reap once they quit smoking, and the application that I will be, the intervention that I will be implementing, and along with when and how she will be informed of the progress of the project. The office person would be given a brief overview of the project so that you'll be equipped to answer questions that the patients might have when she's scheduling them. And then the patients will be given full disclosure of the project about the risk to their health, the benefits from quitting, and then information on how to quit smoking with text message support. I have created a video and a brochure that has information about the risk, benefits, how to use the smoke-free text application, and then the brochure includes as well tips of former smokers. The theoretical foundation for this education. The theoretical foundation for this education I will be using is the self-determination theory by Edward Deci. It is a macro theory that is concerned with human motivation and personality that that is about people's intrinsic growth tendency and psychological needs. It is concerned with the motivation behind choices people make and without external influences. It focuses on the degree to which the individual's behavior is self-motivated and self-determined. So basically, it means that people perform best when it's intrinsically motivated, and in order for a change to take place, people must understand the need for the action to make informed choices. And then the conceptual framework that I will be using for this project is the health-belief model. The health-belief model in smoking cessation emphasizes that smoking is determined by the person's perception regarding their vulnerability to illness caused by smoking, the seriousness of smoking as a problem, the treatment cost and effectiveness, the barriers they might have of quitting, and the cues to change their smoking behavior, and their self-efficacy, which would be the belief in their ability to quit smoking. So smoking continues to be a major health hazard in the world, especially for patients that are for people that are diagnosed with a mental illness. And it is up to us mental health providers to put aside all the misconceptions that exist about patients diagnosed with a mental illness and smoking, and take action to increase the life expectancy and the quality of life for these patients by assisting them and motivating them to quit smoking. Thank you for watching my presentation. I hope it was informative, and thank you. Have a good night.